Hi, my name is Jakob Sole, and I'm here to present our poster at this year's International Vasculitis and ANCA workshop. With our study, we aim to learn if vasculitis patients suffering a stroke present themselves differently clinical or have different outcomes compared to non-vasculitis patients also suffering a stroke. We use two cohorts of systemic vasculitis patients, one with GCA and one with ANCA-associated vasculitis, both diagnosed in southern Sweden between 1997 and 2016. These cohorts were linked to a Swedish National Registry of Stroke Patients. Thereby, we found a total of 143 vasculitis patients that suffered a stroke, either in near relation to their vasculitis diagnosis or afterwards. Each case were compared to 10 matched stroke controls. Looking at our results, we found that there was no differences in smoking status, comorbidities like diabetes or atrial fibrillation. However, there was a higher prevalence of previous stroke among non-vasculitis patients. This might explain the higher prevalence of antihypertensive treatment and statin use in this group. We suspect this is caused by a selection bias when we retrieved the data from the stroke registry. Therefore, we performed a stratified analysis leaving out these patients, and there we found no differences in antihypertensive treatment or statin use, although there was a trend toward it. Looking at clinical presentation at admission, such as radiographic diagnosis and level of consciousness, there was no differences. Also, complications during admission, such as deep vein thrombosis, fractures, or pneumonia, were equal. At 3 months follow-up, there was no differences in mortality or degree of mobility between groups. Stratified analysis of each vasculitis cohort also found no differences. Therefore, our conclusion is that we find no major differences in baseline clinical characteristics, admission-related complications, nor mortality at 3 months follow-up between patients with systemic vasculitis and non-vasculitis patients with an incident stroke. Thank you.